This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today I'm going to explain thoracic outlet syndrome. So what is thoracic outlet syndrome? Well, that basically means either the nerves or vessels up in this kind of area, your neck, upper shoulder area, are getting compressed, and when they get compressed, they get irritated, and that would cause either tingling down your arm or kind of a loss of blood flow. People often described it as their arms will go cold, they get weak, they get tired, they get tingly. Usually the tingling is kind of in the pinky or ring finger of the hand. And these things are usually worse with overhead sort of activities like combing your hair or that sort of thing. But how does somebody get it, and what does it really mean? So nerves can be compressed at any point when they come out. Some people who have a slip disc in their neck or something like that, or arthritis, will have it compressed in the neck. Or you can have it compressed in the wrist, and that's carpal tunnel syndrome, or compressed in the elbow, that's cubital tunnel syndrome. The thoracic outlet syndrome basically means the nerves are compressed as they exit the muscles of the neck and when they go underneath the clavicle, between the clavicle and the first rib. So they can either be compressed by the scalene muscles in your neck, or they can be compressed by the clavicle and the first rib. Sometimes people will have an extra rib, and it'll create the symptoms that I described before. I'll see this pretty commonly after car accidents. I think that a lot of people get, whiplash after car accidents, and it'll kind of tighten everything up. And I'll see it, more commonly after a car accident as those nerves are compressed. And it's not coming from the neck, it's not coming from their elbow or their wrist. It seems to be coming from the thoracic, from the area by their neck, not necessarily their spine. It's more of a difficult diagnosis to make. It's based on some clinical exams. There's not really any, MRIs or anything unless you find an extra rib or some sort of anomalous structure. That'll really help you with this. You can also do vascular studies to determine if the artery is getting compressed. As far as what to do about it, most of the time, thoracic outlet syndrome will go away with some, simple physical therapy, exercises, and stretches. That takes care of mostly all of it. Now, if you have an anomalous structure like an extra rib or something compressing it, then you're looking at, and you've tried the physical therapy and it hasn't worked, then you're looking at other options. So normally these are done by a vascular surgeon. They'll either kind of remove some of those muscles in their neck, or I should say resect them to create more space for the vessels and nerve, or sometimes they'll actually remove that first rib or part of it to let the vessels have travel without being pinched. But by and large, I don't think I've sent anybody to that in a long time. Most people get better with therapy and exercises. The problem is getting the diagnosis, which can sometimes take a long time, as people will mistakenly say it's from the spine when it's not, and then getting an adequate treatment plan. So I hope I was able to explain thoracic outlet syndrome. If you have any questions I didn't answer, feel free to leave them in the comments below, although I can't respond to specific medical histories. If you like this video, we put out new content weekly, so please like and subscribe, and thanks for watching.